After facing criticism for leaving many healthcare workers off its Phase 1 priority list, the government has added more than 11,000 to its Phase 1 plan. That means it will vaccinate about 200,000 people and send out about 400,000 doses of vaccine as part of Phase 1. It says it's committed to remaining focused on the long-term care residents and staff and the elderly, those who are most at risk of negative outcomes from COVID-19. So, in the coming days, the province will send vaccine to Swift Current and the province's southwest, an area where cases are currently low.
About 50% of our long-term care residents and staff have had their first dose, and we have about 20% that have had their second dose. And we do have a number of long-term care residents and staff and facilities throughout the Southwest. And so we want to make sure that we are prioritizing within Phase 1 those residents that are elderly and are at highest risk of negative outcomes when it comes to contracting COVID-19.
Mo says he's more positive than ever that the supply of vaccine will increase in the next few weeks. But until more people are vaccinated and case numbers drop more, the province's restrictions will remain in effect until March 19th.
I've spoken often to the opportunity to potentially expand our household gatherings, our household bubbles at some point in time. I don't think we're quite there yet today. But that may be one, if we can continue on this trend of reduced numbers, reduced hospitalizations, and ultimately reduced fatalities in the days ahead. That might be one that Dr. Shahab may be able to look at on, previous to the 4 weeks going into, up to and including March the 19th.
Dr. Saqib Shahab says the government will increase the number of samples it screens for variants. He says because some variants are seen to be 70% more transmissible than the dominant strain of the virus, people need to continue to follow public health orders.
I think that's why it's essential that even though our numbers are trending down, we remain very cautious. We keep the numbers low till our vaccination program has had the opportunity to especially protect the most vulnerable, 60 plus and then 50 plus.
All 10 provinces have found a variant of concern. So Shahab says people shouldn't travel unless absolutely necessary. He says if you do travel, you should monitor yourself upon return and keep your contacts low. Adam Hunter, CBC News, Regina.